Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat petang dan salam sejahtera. Alhamdulillah, bersyukur kepada Allah Ta'ala pada petang ini dapat kita berjumpa dalam webinar entitled Medical Specialist Training Programs at KPJUC, KPJ Healthcare University College and KPJ Specialist Hospital. My name is Dr. Lokman Saim. I'm the Vice Chancellor of KPJ Healthcare University College and for short, KPJUC. First of all, I would like to thank everybody who is with us today, joining us in this webinar, especially to our frontliners, the medical officer, housemen, and I understand that there are also our young budding doctors, our medical students from various universities in Malaysia. So thank you very much for spending the afternoon with us at KPJ UC and KPJ Hospital. Well, we are going to spend the afternoon discussing a very, I would say, relevant topic related to the, I would say, event of the year. That is the recent Hartal. Yeah? I think it's relevant to most of you, our frontliners. Maybe some of you are now joining through from COVID wards, joining from the PPV, stop work for a while and be with us. But inshallah, we will not disappoint you because we will be telling you everything about a medical specialist training program in KPJ Healthcare University College and KPJ Specialist Hospital. Well, maybe to quite a number of you, when you receive this flyer, question right into your mind. Wait, apa ni? Ada specialist training kat private ke, you know? Or some of you will ask, is there apa ni? Ada ke KPJ Healthcare University? Where is it? You know, because sometimes, you know, after working in KPJ Healthcare Universities, I still get those questions myself. You know, they ask me, where do you work? I say, I'm working at KPJ University College. I say, ada ke University College ni KPJ? Well, I hope all of you knows about KPJ Hospital, the largest healthcare provider in Malaysia. We will hear more about that. But don't worry, all these questions and many other questions regarding specialist training in private will be, inshallah, answered by us today. I would like to actually conduct this webinar secara santai, relax. So don't need to take notes like a medical student. Tak payah take notes, pen, pencil ke apa. Just listen. And therefore, there will be no MC. I'm the MC, I'm the moderator, and I'll be the speaker. But I am supported ably by 8 other speakers with me, which I will introduce one by one. The 8 speakers are number 1, Datuk Farid. Datuk Farid is the regional CEO and a big man in KPJ Hospital. He will talk to you more about the facilities, the consultant and the patients in KPJ hospitals. And we have 7 other speakers who are directors of the KPJUC postgraduate programs. They are consultant medical specialists in their field. So they are very busy people. But I'm thankful that the 7 of them will be joining us to discuss and explain to you in detail about the training program in the various specialty available in KPJ. You know, I know Saturday is very busy for private consultant because this day where many patients will come to the hospital. Okay, I will not waste time. I would like to invite now the first speaker, Datuk Farid. I've introduced this briefly. He is the regional CEO of KPJ Specialist Hospital from KPJ Healthcare Berhad. Silakan bagi Datuk Farid.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh.
Waalaikumsalam.
Yang berbahagia Profesor Dr. Luqman, all the distinguished program directors for this medical specialist training of KPDUC, rakan-rakan virtually engaged with all of us this afternoon. Thank you for your time. I am Muhammad Farid Salim, basically looking after the overall operation of some of the hospital in KPJ Healthcare Group. I will briefly describe and run through of what we are, KPJ Healthcare Berhad, and hopefully, apart from giving you the overview of the company, I will explain a bit in terms of the overall framework of this program in KPGUC. Okay, I will start off by opening my slide presentation. Bear with me for a second. Okay, briefly, an overview of the corporate structure of our organization has been mentioned by Prof just now. We are KPJ Healthcare Berhad, so-called the second largest healthcare provider, second to Ministry of Health, MOH. Yeah. KPJ Healthcare University is 100% owned by Kumpulan Perubatan Johor Sdn Berhad, and eventually is owned 100% by KPJ Healthcare Berhad. We are proud to say that we are the homegrown entity, local brand, and have been in the business for more than 40 years. Yeah, I think that speaks a lot about how we are now, being from 2 hospitals initially in Johor and Ipoh, and we have grown to 28, and by 2023, hopefully, we can have 29 or 30 hospitals. These are the management team that lead the company, led by our President and Managing Director, Encik Ahmad Saizam, and supported by all the C-suite executive, as well as all the regional CEOs that looking after the operation of the hospital within the KPJ group. Just to indicate how big we are in terms of our operation in the country and outside the country, we have more than 15,000 of employees in the group. In terms of medical specialist consultant, we have about 1,300. We treated on average outpatient number of 2.6 million a year, inpatient of more than 240,000, and available operating beds in our group more than 3,500 beds at the moment. This is where we are. We are spreading all over the country from Perlis to Miri. The only 2 states that we have yet to make our presence is in Terengganu and Melaka, and hopefully soon, with all the structure in place, hopefully we can get to be in the 2 particular states in the near future. As we mentioned by Prof Luqman just now, yeah, we have around more than 1,300 medical consultants. Many of those are former professor and senior consultant in MOH. The only thing that you can see from the photo, I think this photo is something that been taken 20, 30 years ago. Maybe by the time you register with KPDUC, you will be able to recognize them by looking at this photo. Yeah. We have Mr. Razak, we have Prof. Prima, we have Dr. Zairin. Who else? So we have Dr. Azlin, Dr. Wahab, Dr. Nick, and the rest. of all the renowned professors and consultants that will assist you in the program when you join KPJ-UC later. I think it's very important to recognize that KPJ, our core business is private hospital, but at the same time, we'll be able, as part of our transformation as a private hospital, by having KPJ-UC to be part of our transformation journey, whereby we are enhancing the presence of KPJ-UC in providing the best quality medical and health education for the country. And at the same time, we cannot run away, being a university, to be part of the research center so that we can be part of the renowned brand as far as the medical university is concerned. Yeah. Taking what had been committed or been said by our President and Managing Director, quote, I am committed to ensure that the medical specialist training programs integrated into clinical initiatives at KPJ Hospital and in sync with KPJ strategic plan. I think this is clearly demonstrate that the commitment of KPJ not only ensuring that we have the best hospital in the country, but at the same time, how are we going to ensure that KPJ-UC in part of the journey in ensuring that we can provide the best quality of care to all our patients that coming through our door of the hospital. For the next few slides, Prof and the rest, I would like to emphasize in terms of the program itself. Yeah. The framework of employment as registered MO and senior registrars pre-NSR in KPJ Specialist Hospital. Looking at this pathway, the A and B is basically dedicated to the company function in terms of budgeting and selection of the candidate. But for the candidate itself, for themselves, I think the circle C, D, and E is to be much of your interest, and I will explain further in my next slide. Yeah. Throughout the 4 years training, if you can see from the previous slide, the item C there, yeah. Once you are being selected to this program for 4 years, you will be part under so-called of our employee in some of the hospital, yeah. And along the way, during your tenureship as a employee MO in our hospital, you will be receiving a monthly cost of living allowance from KPJ Hospital. Apart from that, after the graduation, pre-NSR, you will be granted an employment with KPJ Hospital, and at the same time, you'll be seconded to some of the KKM and University Hospital to obtain more experience in terms of getting your NSR. Yeah. And after you getting your NSR, you completed your NSR, you will be getting an offer from KPJ to be as a salaried consultant within the group of hospital in KPJ. Okay. And at the same time, I think this is something that is new from Prof. Lokman. Our initiative with KKM in offering the contract MO to join this program. And I think this is subject to the agreement between KPJ and KKM, and it's still in the pipeline. As been mentioned, after you get your full NSR, hopefully we can offer you to be part of our consultant team in KPJ Healthcare Berhad. Other initiative in enhancing KPJ as a regional brand for healthcare, I think this is coming from Prof. Lokman himself for the past 3 or 4 years. The initiative of getting young physicians in ASEAN region to be part of learning curve in our organization, yeah, be it from within the ASEAN country to Malaysia, as well as Malaysia to other ASEAN countries. I think this is the platform, a good platform for KPJ Healthcare Berhad to contribute towards the teaching and training of young physicians in the region. And I think we have started this program, if I'm not mistaken, for the past 4 years. Yeah? again, what I've said just now, we want to be placed in the world map. Hopefully, by having you on board in the future, you can be as good or as high as Johns Hopkins University. Yeah, that will be our ultimate challenge, our ultimate aim to be the best brand, hopefully one of the renowned brand, preferred brand in this part of the world. In summary, we can say that the commitment of KPJ by having 28 KPJ hospital in the group, supported by 1,300 medical consultants, hopefully it can give you an excellent environment and the tools for you to train and be the best product of KPJ you see as a training specialist and qualified specialist. And at the same time, I believe that the management is committed toward the integration of healthcare services, education, and not to forget KPUC as a university to be the forefront of the research activities in the country. Yeah. And more importantly, we are an organization that have been in the business since 1991. Yeah? For the KPUC have been in the business since 1991. We hope that good track record will provide you the pull factor why you choose KPUC as your next stepping stone in pursuing your career as a medical specialist. With that, Prof, I conclude my presentation. Once again, I would like to thank everybody who make your time for this session this afternoon. And thank you to Prof. Lokman and the team. Thank you for the program director for making your time to present your paper today. And all the best to all the prospect candidates there. And hopefully you will be part of our success in the future. With that, thank you. Assalamualaikum warahmatullahi ta'ala wabarakatuh.
Waalaikumsalam, Dr. Farid. Thank you very much, Dr. Farid. You have made it clear the strength of KPJ hospitals. In fact, while you were going through the numbers, 20 hospitals, dah ada dua komen, Dr. Farid.
Yeah.
Dia tanya, how can I apply? dah tanya nak apply ya, kepada Dr. Hafiz and Dr. Wanisha. Thank you very much. We will answer that question later. Yeah, I will collect. Hafiz nak join anesthesiology. I am interested in anesthesiology. Okay, we will inform you how to apply and all that. Yeah. All right. So now it's my turn. We have heard about the hospital, its strength, and the support for education and not only education, the research. Now I would like to explain a little bit more about the medical specialist training in Malaysia. I call it my presentation as a transformation because, as I mentioned, probably some of you boleh ke ni private hospital buat training ni, yeah? Well, I'll try to answer that. Right, I would like to go back to 2013 because in that year I saw we just started the program. I saw a lot of media, print media, social media talking about the need for specialists and in Malaysia and the lack of training resources. Almost every month, minister lah, director general kata private hospital urge to train all specialists, anesthetists. We need more. We need 1,800. Where can we train them and all that? Next slide, Cik Imran. And it was actually quite coincidental because we in KPJ, you see, we already planned to have medical specialist training even back in 2011, 2012 when KPJ nursing school was upgraded to become KPJ Healthcare University College, and we started this idea of starting the medical specialist. Now, bring forward, Imran, one more slide. Bring forward, now we are in 2021. This year, as mentioned just now, also another uproar about doctors, about training and all that, yeah? And of course, now some people believe that we have too many doctors, too few jobs. Some believe that we are not we don't have enough training because we have too many doctors. And because of this, I mean, recently, just this week, our Prime Minister himself announces the better terms for Malaysian contract doctors. You know, the government pledges to look into all your concerns about being a contract MO. But I know in the social media, many of you are still not happy. And therefore, next slide. On the 26th July, was it 26th? Correct. 26th July, you all stay, I mean, not you all, I mean, quite a number of doctors still stop for a while and go out of the hospital and tell the public that we are still requesting better work conditions, better offer of work in the Ministry of Health. No, so to Imran, before that. And if you look at this, number one, saya doctor contract. But you look at the back, specialists in the making. You all are special in making. Yet, our future is aching. You know, the wide number of doctors and MOs yang contract worried about their ability to join the master's program or the parallel program if you continue to be contract officer. Next slide, Cimran. That's why we feel that this not it's also a role of the private hospital like KPJ to contribute to teaching and training. If you look at the distribution of doctors and specialists in the country, look at the bottom one, 44 point. This is 2013 data ni. 2013 said almost 50% of specialists are in private, and to me, that is untapped talent to train specialists. They are capable, they are experienced, and therefore they should offer their services to teaching and training besides being a consultant in private. Next, Imran. So we have started this. I won't go into the history until I'll just straight into why KPJ are doing this. Why training in private hospital? Number one, as I mentioned, to harness the potential of private specialists in teaching and training. We have mentioned now there are thousands of specialists in private, in KPJ, 1,000, more than 1,300. Why not we engage them to train the MOs and the young doctors in Malaysia? Next, the other objective is, of course, private healthcare hospitals, private hospital like KPJ should transform, and Alhamdulillah, KPJ is in that mission to transform private hospital, as mentioned by Dr. Farid, not just being a hospital that gives service, hospital that's committed to training and research. And this is termed as academic health center. No matter private ke, public ke, a hospital should be an academic health center. And the highest ranked hospital in the world, in the US especially, are all hospitals that are involved in academic. So that's what KPJ wants to be. Next. Right. But there's a catch here. You cannot be training in private hospital like we train in public hospital. I'm sure most of you are from the public hospital. What more now? Too many patients, too many medical students, housemen, MOs, junior specialists, all wanting to learn. It's too overcrowded lah. So in private, I would like to inform you that there is need to do it a different way. Next slide, Imran. Clinical training in private has to be small number of, it's small number of trainee to trainer ratio. Yeah. In our case, we do what we call 1-to-1. Example here, the trainer is looking from the assistant, from the assistant, using the assistant microscope screen lens, while the trainer is the one who's doing the operation. But once the trainer is confident, dah dapat tahun 3, tahun 4, you may switch role. The trainee will do the operation, but the trainer will be right there beside you, teaching you, guiding you, giving you the chance to do, but if you make a simple, out of the way operation after got surgery lah, the surgeon is there to guide you, to correct you, and to give you feedback. Next. So that is the hallmark of our training, where you are always supervised by your trainer, one to one, the most important one. And I tell you, patients are happy with this. Ever since 2012, even in the ward, patients are happy because there is a trainee who is what we consider as a specialist training or young specialist training, always in attendance with the consultant, working together, giving better service to the patient in private. Next. Next chamber. ODUS established overseas. In Malaysia, you have not heard of this kind of training. But this kind of training has been overseas. You look at this, and people are publishing about this kind of innovative new way training. Look, this is from the Australian New Zealand surgical journal discussing training in private sector. What works and how do we increase opportunities? This is exactly what KPJ University and KPJ Hospital are doing. People are our line. Sorry. All right. Next. Tu yang atas scroll line ni. Okay. So with that kind of idea of training in private, we have started the master's program. And the first one was in ORL, head and neck surgery, 2012, followed by Masters of Radiology, Masters of Orthopedic, Master of General Surgery in 2015. And in ORL, we have already got about 6 graduates. Radiology, we have 4 graduates. Orthopedic, we have 2 graduates. And General Surgery, we have 1 graduates. So you must be wondering, how come tak baruakan, kenapa tak tahu ada program dah ada graduate pun. Well, pepatah Melayu kata diam-diam ubi lah. We are quiet, but because we have just started and our number are small, so hopefully with all this experience, and most important is after getting all the approval, because our program went through all the accreditation process from the National Conjoint Board, the Malaysian Qualification Agency, most important from the Malaysian Medical Council, so that our graduates are recognized and able to register as a specialist. We have started 2 new programs that is not in the master's program. Yeah, one is postgraduate training in internal medicine. As you know, quite a number of doctors, instead of joining a master's, they sit for the MRCP, or for pediatrics, MRCP child health. So we not only guide, in these 2 programs, not only guide you to sit for the exam, but we want to give you the training, the 4 years, 4.5 years of training, so that along the line, you got your MRCP, but you are well trained that when you can at the end of your the training, you're able to be registered as a specialist in the NSR. Now, you're going to hear more about this later from the directors. Next, Cik Imran. Next. All right, our program, in the beginning, we need help from an established university, and the established university that gives us a helping hand is University Kebangsaan Malaysia. I would like to take this opportunity to thank UKM, Faculty of Medicine, UKM Hospital, Tuanku Mukhris, for them to support, give us a helping hand in conducting this program. So, as mentioned just now, I hope I have convinced you that we are capable of delivering new teaching and learning way methods of grooming you to become a specialist, clinical apprenticeship, one-to-one mentoring, student-centered, clinical-based kind of teaching. Next, Cik Imran. Ada lag. So, as I mentioned, the hallmark of the training program is one-to-one hands-on apprenticeship, where each resident is supervised by one consultant, and resident will be supervised by experienced KBA consultant on a 3 to 6 month rotation. And as the resident gain experience, more proficient, should be allowed to progress in the supervised clinical skills learning opportunities, given increasing responsibility in formulating diagnostic workup, and resident can evaluate the inpatient, emergency condition under supervision of our consultant. Next. Next. Cik Imran. Similarly, in the operating room, resident always supervised, but to be more in decision making, so that they are able to acquire all the skills at the end of the day. We have televideo conference facility in KPJ, so if you are all in separate hospital in KPJ, we can still conduct tutorials, seminar through virtually. Like for example, you see the photo on the left, a lecturer from KPJ, I think was Tawakal, giving tutorial and is Zoom to the group in UKM on the TV screen. Next. So we have started all these Zoom and all, not Zoom lah, all these televideo conferencing facilities in KPJ when we started the program. Lastly, I would say that in the future, we will be building more, training through using skills lab and simulation. Next, can we just, Cik Imran, go through the next photos briefly, just quickly. Next, because we are running out of time. At the moment, we are using the simulation lab in UKM. Carry on. This is the lab at UKM we are fortunate to share with. Next slide. Where it is well equipped for training in keyhole surgery. Next. I'm very surgical biased because I'm an ENT surgeon. So in the simulation lab, we can do all kind of laparoscopic surgery using ship, or mainly we use ship. Kalau kat West we use PIC, and even the exam, teach how to tie can be done in the lab for your training. Next. All right, so I hope I have convinced, next slide, I convinced you that the training next in KPJUC is at par. Some people claim, especially claim better than in the public hospital. Now, the last part is important, I think, for you all. I saw many questions, Dani. requirement for become specialist. So I just run through quickly, yeah, the journey to become specialist because it's different, yeah, journey in Ministry of Health and in private institution like KPJ Hospital, right? I just in private in Ministry of Health, you join the master's program, or now you can also join the parallel program. You are employed by MOH. And now they announce that even yang contract pun boleh join kan. Usually you get JPS scholarship, but I don't know whether contract can get scholarship lah. But after graduation, the main difference kalau dekat hospital kerajaan is you only need 6 months of gazettement in MOH hospital. Remember, MOH hospital or university hospital, you go through gazettement for 6 months. And after that gazettement, in the Ministry of Health, you are recognized. I put that in bracket comma because kalau ikut Medical Act, you are not yet a specialist until you register with NSR. But in Ministry of Health, here they have not implemented that. So as soon as you graduate from medical school, master's program or parallel program, you fulfill 6-month gazettement, then you sort of declare yourself as specialist, and for MOH specialist, registration in SR can be done later. Yeah, but in private institution, because Dr. Farid, yeah, we are under the Akta Hospital Swasta. Dalam Akta Hospital Swasta, you are not a specialist until you got your national specialist register. So that's the main difference. So many of you already asked me, kat mana gazettement untuk KPJ program? Well, in KPJ program, there is no such thing as gazettement in Ministry of Health, yeah, because different system. In private institution, when you join the master's program or the parallel, so-called parallel program, MRCP and MRCPCH, you are already a private doctor. You're employed by KPJ Hospital. And you have to, of course, pay the fee, self-paying fee lah. Although I must inform you also that we do provide assistance for you to apply for Bank Rakyat loan, and we give some sort of a letter of support for you to apply for the loan. You can also get loan from Mara, or now we are working with Peneraju to provide that. But you are a private MO, yeah, in KPJ. And so after graduation, you cannot immediately become a specialist, even though you are dah dapat masters. Yeah, you have to apply for NSR. But to apply for NSR, they need evidence that you have worked in a hospital and worked as a specialist service MO. Yeah, you cannot become an MO dekat casualty ke kat wellness and then apply for specialist, even though you have a certificate of masters of ENT, for example. So where do you work for that 2 years before you can apply for an SR? Well, KPJ is so kind that we employ you as an MO to work in KPJ Hospital together with the consultant. So you're giving specialist services. You have to log your book, log your cases, and after 2 years, but in anesthesiology, I understand it's only 1 year. After 1 year of working as a junior specialist in KPJ, that's why we call the term pre-NSR work. Sebelum NSR, yeah, we call them senior registrar, employed by KPJ. Gaji dia lebih besar daripada when you are student. Bukan gaji lah. The cost of living allowance we gave you for this pre-NSR is double than what you get as a student. And then once you completed the 1 year or 2 years of training, further training, then you can apply for NSR and recognize as specialists. So that is the different journey. I hope you all understand this because it's totally different. And you cannot ask me where do I get my gazettement, because in private there's no gazettement in KPJ, it's NSR. And after you got NSR, you can work anywhere in Malaysia. You're specialist, you're a consultant. So you can work in private hospital, you can work, in this case, KPJ will offer you. You can work in private clinic, private university, so anywhere else, public hospital or university hospital. Next. I hope that's clear, yeah? Next slide. That's why yang Datuk Farid tunjukkan tadi, that is the framework that the hospital at every level will support you. So commitment Wakil Hospital has already been explained by Datuk Farid. I hope I don't have to explain to you again. Next. Let me just inform you, maybe this information important. As a student, your cost of living allowance is 5,000 a month. And as a pre-NSR, after you graduate, your cost of living allowance given hospital is 10,000 a month at the moment. And then when you has your NSR, you become a salaried consultant. You are employed as a salaried consultant. Around the figure is around 22 to 23,000 a month. So I think for the save time, I will not go through this. Basically, we have the hospital and the training, and it's recognized by MMC for the program that you offer, including the so-called parallel program. I'll end with this quote from Nelson Mandela. It's always seemed impossible. I'm quoting this for yourself lah, for all of you in the M1 houseman. Macam susah aja nak buat dekat private ni. Macam susah aja saya nak dapatkan place dekat hospital kerajaan. Macam susah aja nak specialist. No. There are ways, and one of them is going through the KPJ healthcare system, and it's always seemed impossible until it's done. So thank you very much for your attention. Now I will proceed because we have few more speakers ni. I will proceed. I would like to invite the first Professor Clinical Primo Harsa. I'm also looking through all your comment. I know a lot of questions. I'm taking it down. You will answer later, yeah? Prof. Har, he's an ENT surgeon, a consultant, an academician. He published a lot of... Silakan, Prof. Har.
Okay, thank you, Prof. Lokman, for the kind introduction. Okay, Assalamualaikum and very good afternoon for everyone. Okay, so my can hear, Prof. Ada echo lah. Okay, so I will deliver.
Yes. Boleh. Teruskan.
Master Program of Otolaryngology Head and Neck Surgery KPJ University College. Okay, next slide please, Imran. Okay, so why you should join Master of ORL Head and Neck Surgery in KPJ UC? So our program is the first private master program in Malaysia. Like Prof. Lokman mentioned just now, we started in December 2012, and currently it's a well-established program, which is Master of ORL KPUC is a member of the National ORL Conjoint Board, and this program is the first private medical master program to be accorded full accreditation by MQA, which is in 2016. And we are also the first private master program to be recognized by MMC in 2018. Okay, next slide please. Okay, so this is the full accreditation certificate from MQA. Okay, next slide please. And this is also a letter of recognition our program by the MOH. And why we need this one is because we also have a collaboration with the Ministry of Hospital, in which we send our trainee not only to UKM hospital, but also only to the Ministry of Health hospital. Next slide, please. And with regard program overview, our program is a full-time 4-year clinical training program. This is like other program which is established in UKM, UM and the USM. So our program is conducted in collaboration with the Department of Otorhinolaryngology and Neck Surgery, Universiti Kebangsaan Malaysia. And our candidate mainly trained at accredited KPJ hospital. And also they will be posted to Department of Otorhinolaryngology UKM and on the between 1 to 3 months, okay, and also a Ministry of Health hospital. And our curriculum is follow the standard Master of ORL HNS, which is determined by the National ENT Conjoint Board and also MQA and also Malaysian Medical Council. Next slide, please. And the admission criteria for our master program is possess a medical degree or equivalent qualification from university recognized by the Senate of the University of College. And you must be registered with medical for medical practice by the MMC and possess a valid annual practicing certificate. And the other requirement is at least 2 years of clinical training or practice up to obtaining medical degree and completed housemanship. And also this one, some program they have must have obtained satisfactory mark in the medical specialist pre-entrance exam, MEDEX. But for the ENT, we actually we haven't joined the MEDEX. Okay, so we the whether we are joining or not, we will determine later. So the selection criteria, part of the selection criteria is we will conduct interview, okay, and the interview will be conducted by the consultant and also by the KPJ HQ. Okay, next. So this is the next slide. Okay, like Prof. Lokman mentioned just now, our hallmark of training in private is one-to-one hands-on apprenticeship. It means the trainer will train the trainee in 1-to-1 ratio. So there will be a close monitoring and supervision. Okay, and also by also mentioned by Prof. Rahman, because there is a lot many of the talented consultant in the private hospital. So the joint training is to optimize talents in the private hospital. Okay, next. So our candidate also will conduct research because they have to complete the dissertation in which they have to conduct research within the 4-year study in the program. And they also will participate in international RL conference as a speaker for oral presentation, poster presentation, and also maybe take part in the competition for research. Next slide, please. Okay, with regard to the examination and assessment, the part 1 examination, which is at the end of the 1 year, so the candidate will sit the part 1 examination together with the Department of ORL HNS from UKM. So this is combined, okay, they sit together. And also within these 4 years, they have to fill up the logbook. They have to fulfill the requirement before they can sit at the end of the final year exam. Okay, and they also have to write a complete case write-up, at least 10 cases. So this case write-up is either they want to complete just to bind it, or they also can publish the case write-up in the various journal. So this is part of our training. And like I mentioned just now, they have to complete the research dissertation, and this research is going to be conducted at the various KPJ hospital and supervised by the KPJ consultant. So, the part 2 examination, which is at the end of the 4 year, candidate will sit for the final exam, which will be organized by the conjoined board. So during this exam, there will be 4 university, the USM, UKM, USM, including KPJ. So all the candidate will be there and will be examined by all the specialists from the various university. Okay, next. Okay, at the end of the 4 year, if they pass the exam, they will be awarded the Master of Otolaryngology Head and Neck Surgery by KPJ Healthcare University College. Next slide, please. Next, okay. So till now, we have there are 6 graduates from this program since 2012. So four of them already obtained an SR. So one of them currently working as salaried ENT consultant at KPJ Ampang Puteri, KPJ Klang, KPJ Tawakal, and KPJ Rawang. The other 2, they are still in the pre-NSR stage, and one is at KPJ Seremban, and the other one is with UKM. Okay, I think that is the last slide. Thank you very much. The last slide. Thank you very much.
Okay, thank you, Prof. Har. We are really running short of time, but we have another 6 speakers. So I would like to call upon the next speaker, that is Dr. Wahab.
Okay.
Silakan, Dr. Wahab. Dr. Wahab is a consultant, orthopedic surgeon. He is in KPJ Ampang Puteri.
Okay.
He's very passionate about teaching and training young orthopedic surgeon.
Thank you, Prof. Oman. Assalamualaikum, very good afternoon. To everyone. Assalamualaikum, very good afternoon to everyone. Wow, the echo is going to kill me. Oh, anyway, I am Dr. Wahab. I'm from Puteri Specialist Hospital. I'm the program director and also orthopedic surgeon in this hospital. I think I'm going to run it very short. The presentation I'm going to give probably similar to Prof. Prima Husra, which I think because it's the same program, basically surgical program. But mind you, orthopedics is a very popular program and is a course that is frequently sought after by most junior doctors. So there is a lot of competition to get into orthopedics, and you have to sit for the entry exam, the MEDEX. Okay, next, please. Okay, as usual, the plus points why you should join us is that we have many senior orthopedic surgeons among us in the KPJ hospital, and some of us are former professors, academicians, from various universities, and some are very senior consultants from MOH itself. And we have very well established orthopedic services with state-of-the-art facilities for orthopedic surgery. And we have also a lot of specialties as well within our department. And most of us are quite passionate in teaching and also training budding orthopedic surgeon. Next, please. These are some of the pictures or faces of our teachers within the orthopedic fraternity. I think they are not put according to age, I think. Next. Okay, the program is 4-year program, just like ENT. Master's Orthopedic programs conducted with collaboration with UKM Orthopedic Department. Candidates will be trained and accredited KPJ Hospital and Department of Orthopedics in UKM. And the curriculum follows the standard of Masters of Orthopedics determined by the Conjoint Board and also MMC. Next. So the admission criteria, you must possess MD, MBBS, or MBBCHB or equivalent qualification from universities recognized by the Senate of our universities, must be registered with the medical practice by the MMC and possess a valid APC. At least you must have 2 years of clinical training or practice after obtaining a medical degree and completed housemanship. And you must obtain satisfactory mark or band in the medical specialist pre-entrance exam. They call it MEDEX, orthopedics. And the date of commencement for this is next year. and satisfactory performance at the selection interview conducted by us and KPJ Specialist Hospital. Okay, next. The training design, the orthopedic curriculum follows just like UKM Doctorate of Orthopedics program and the conjoint board and MMC standard. However, the KPJ Specialist Hospital, at the KPJ Specialist Hospital, the board of training is designed to suit the private specialist hospital surgical services expectation. We have one-to-one apprenticeship training, and the rotation is about 1 to 3 months to each supervisor. In the year 1 and year 2, the candidate are posting to our hospital, KPJ Specialist Hospital, and year 3 and 4, you are posted to the Department of Orthopedics in UKM. Next. Examination and assessment, part 1. Examination is at the end of the year 1. Candidates sit for part 1 examination conducted by Department of Orthopedics UKM. You have to write. Pardon? You have to get your logbook done, case write-up, 10 cases, research dissertation to be conducted at KPJ Specialist Hospitals with supervision from KPJ and UKM consultants, and to be completed and submitted 6 months prior to the Part 2 exam. And Part 2 exam, which is at the end of 4th year, candidates sit the final exam organized by the Orthopedic Conjoint Board and conducted at major universities. And the degree awarded is Masters of Orthopedics, KPJ Healthcare University College. Yeah, I think that's all from me. So I will entertain the questions a bit later. Thank you. Thank you. Hello. I think I saw questions about MQA just now. I think we'll probably get the answers by the end of this year, isn't it, Prof. Lokman?
MK accreditation. Yeah.
End of this year, inshallah. Yeah.
Is that
So,
all?
please take over.
Yeah.
I
Thank you
finished.
very much.
Thank you.
All right. Thank you very much. Now I would like to move on to Dato Azlin. Dato Azlin is Director of Radiology Program, and they have already graduates from this program. Please, Dato Azlin.
A kind introduction. Assalamualaikum and good afternoon to everyone. My name is Dr. Azlin Azizan. I am the consultant radiologist based at Ampang Puteri, KPJ Ampang Puteri Specialist Hospital. I'm the director of program for the radiology course in KPJUC. As stated by our Dr. Lokman just now, the radiology program is the second program in KPJUC that has been started in the year 2013. Our first intake of students was in the year 2014, and up to date now we have already had 5 students who has graduated and obtained their master's degree and are now attached at the various KPJ hospitals for their PNR training. Okay, so I will go just briefly to all the information about the radiology program. Some of it has been mentioned by my colleagues, Dr. Wahab and Dr. P. Muhasa. I just highlight a few things that is unique to radiology. Okay.
Yeah, that's good, Dr. Azlin. We want to have more question and answer. Yeah.
That's right. So the program overview is basically the same. It's a 4-year program, and I think the requirement also the program is the same. And I'm happy to say that our radiology program has come full circle now. We have the full accreditation by MQA in the year 2020. and also we have obtained the recognition by the MMC also in the year 2020. So our graduates are now fully accredited, and KPJUC can actually award our graduates with the Masters in Radiology from KPJUC. And similar to ENT and also orthopedic, our training are basically done in our KPJ hospitals. At the moment, we have 3 major hospitals under KPJ where the students are being sent and attached to, and they are at Ampang Puteri in Ampang, Damansara Specialist Hospital, and also in Kajang Medical Center. So those are the 3 major hospitals under KPJ for training. I would also like to mention about the admission criteria. Since the year 2003, our conjoint board has made it mandatory for all radiology applicants to obtain this MEDEX pre-entrance examination. This is a compulsory requirement for all radiology applicants, including those who wants to join KPJUC. Okay. And following the exam, we will conduct our own interview for the potential candidates, and from there we will select the candidates to join our program. And I just like to introduce our academic staff. We have actually now 7 academic staff, 2 based in Ampang Puteri, which is myself and Dr. Amran, and 2 in Damansara Hospital, which is Dr. Tajunisa and Dr. Naveen, and 1 in Kajang, which is Dr. Bakri. And we have a few more associate trade lecturers. Dr. Asokan is from Pantai Bangsa. Dr. Jalil is also Pantai Bangsa, and he was the former dean of UPM. We have also Professor Ibrahim, also joining us as a team. He was also previously the former professor in USM. And we also have Dr. Azman, who is also in the Sentosa Hospital. Okay, next slide, please. Just to go briefly through our curriculum structure, we are UKM, USM, UIA, as part of the conjoint board, and we conduct examination together with them. And we divide our structure into 3 phases: phase 1, phase 2, and phase 3. And can I go to the next one, the exam? One thing unique about the radiology exam is that we have a part 3 exam, whereas the other courses, they only stop at part 2. Our part 3 exam is called the exit exam. It consists of a very simple exam, rapid reporting, where the students are given a set of very simple films, about 25 films, and they're given a certain amount of time to actually report on this film. And this is a very high marking system, and they're only allowed to have 4 wrong. That means they can only get 4 wrongs from out of the 25 in order to pass the exam. Okay, so that is the only difference between our program and the rest. And once they have completed the 4-year program, they will be accorded the Master of Radiology from KPJ University College. And as I mentioned earlier, we already have 5 students who have graduated in our program so far.
Oh, sorry, I put 4 there. That was actually 5, yeah?
5, yeah.
Congratulations. Yeah. Thank you very much, Dr. Azlin, for your brief, but I think very informative talk. We will now move on. I would like to invite Dr. Razak, but before that, yeah, I was made to understand that among our audience is Tan Sri Siti Saadia Shebakir. Thank you very much, Tan Sri, for joining us in this session. Just to inform everybody, Tan Sri Siti Saadia Shebakir is our chancellor of the university. She is our pillar of strength, I would say. When we started this program, we get a lot of support from Tan Sri. It was a vision to have this done in KPJ Hospital because Tan Sri was the president and managing director of KPJ Hospitals, KPJ Berhad, at the time when we started this program. So Tan Sri, thank you very much for joining us. Silakan, Dr. Razak.
Assalamualaikum, and very good afternoon to everyone, and also to Yang Berbahagia Tan Sri Siti Saadia. Thank you for joining us. I will share my slides. Boleh nampak slide?
Coming.
Can you see the slides?
Yes, yes.
Yeah. So my name is Razak. I am the program director for the Master in General Surgery for KPG University College. And thank you everyone for coming to listen to me for the next few minutes about the overall the overview of our program here. So you young doctors, so I'm sure many of you would like to be surgeons, and I'm going to talk to you within the next few minutes about how you can be a surgeon by going through our program. So the Master in General Surgery KPUC, we started in the year December 2015. It is in collaboration with the UCAM Department of Surgery, and it is a 4-year program. And we are using the UCAM syllabus. Actually, the syllabus is the same, almost the same for all the universities in the conjoint board. We have KPUC, UKM, UM, USM, and UIA. So our syllabus are more or less similar, and our exams are is the same exam that the trainees from KPUC as well as the trainees from KKM, they go through the same exam. So the part 1 exam will be in HUKM. That is after 1 year of training in the first year. And then once you go to the second year, you go to the third year, and you go to the fourth year, you'll be sitting for the part 2 conjoint board exam, which will be held in a rotation basis. Will be 1 year in UKM, then the next year in USM, then UIA, then UM. And the degree will be awarded by KPUC. And at the moment, we have 2 places per year for the Master in General Surgery program KPUC. So these are our supervisors in the KPJ Hospital, and our training center will be in the KPJ Hospital in Johor Bahru, and the supervisors will be the consultants from the 2 hospitals, KPJ Putri and KPJ Johor. Now we come to a very important part, which is the entry requirement to join our program. So the entry requirement is very similar to the KKM candidates, but you can apply direct through the KPG website. And the first thing you must have is a good score in the MEDEX exam. And the next one will be the interview. The interview will be held together with the KKM candidates, and this interview is organized by the conjoint board. So you will be interviewed by consultants from KPG as well as from UKM, USM, UIA. And we give preferences to doctors who has done surgical posting as a medical officer before, has passed the MRCS Part A, Part B, and has publications, research papers, poster presentations, and has attended surgery-related courses like basic surgical skills course, ATLS, ACLS. All these will be given marks for you to get a high score in the interview so that you can be selected. But the most important will be the MEDEX exam. What we do is that when the candidates apply for the universities to join the Master in General Surgery program, normally in the conjoint board, we will select the top 120 students from the MEDEX results. For example, if we have 300 candidates applying, we will write to the MEDEX board to get their raw marks, and then we will line them up from the top student to student number 120, because we will invite only 120 for the interview. Let's say the top student scored 90 and the student number 120 scored 55. So anybody below 55 will not be invited for the interview. So for those who is keen to join the Master in General Surgery KPUC, you must score at least 55. That means at least the lowest that will be invited to the interview. So the MEDEX score is very, very important. In our program, in the 4 years program, the first year will be in the KPG hospitals in Johor Bahru. That will be in KPJ Putih Special Hospital and KPJ Johor Special Hospital, and you will be doing a general surgery, A&E intensive care in the first 12 months. Then at the end of the 12 months, you'll be sitting for the Part 1 exam, which will be held in HUKM, together with the other KKM candidates. And when you pass the Part 1 exam, you begin to year 2, to second year. That will be in HUKM, where you will rotate in the specialty disciplines. You will be doing neurosurgery, cardiothoracic surgery, pediatric surgery, and urology in the 12 months in HUKM. Then you go to the third year, you will be back in KPJ Hospital in Johor Bahru, where you will be doing 12 months of general surgery with us, with all the supervisors. Normally there will be one candidate, but with 6-7 supervisors. So the amount of teaching you have will be very great. Yeah, not like in the public hospital where you have 12 students with one supervisor. Then when you
move on, Dr. Razak? We are short of time. Sorry, can we move on?
Okay. Then you go to the fourth year, where you will be going back to HUKM, and you sit for the at the end of the fourth year, where you have done your thesis, you have done all the case write-ups. You'll be sitting for the final exam. Yeah. So after that, you'll be going for your pre-NSR training, working as a clinical specialist in the at the moment will be in HUKM. We have one graduate already, that is Dr. Soma, who joined our program in year 215 when he passed the conjoint bar exam in year 2020. He's now working as the clinical specialist in HUKM. At the moment, we have our trainees that are with us now. We have Dr. Vishnu in year 4, and year 3 we don't have anybody. We have year 2, we have 2 candidates, 2 trainees, and year 1 we have 1 trainee. We are still having our partial accreditation. We are due for full accreditation very soon. So that's about the university fees, the allowance. So this is the advantage of joining this program is we have a one-to-one supervision between mentor and mentee. You will be supervised by very senior surgeons who have been in surgical practice for over 20 years. You will be operating or doing procedures under direct supervision by the consultants, and will always be the first assistant in almost every operation. The workload in our KPJ hospital is quite heavy, but you have enough time to do your case write-up, your thesis, as well as to study for exams. And you'll be given ample time to attend courses conducted by HUKM for the master trainees. These are just our trainees that we supervise. And there are some challenges in this program where you are not able to take the cuti belajar from Ministry of Health. There'll be no hadiah latihan for you. There's some financial constraints. You'll need to move up and down between Johor Bahru and Kuala Lumpur over the next 4 years. And moving costs not covered by the KPJ University College. So these are some challenges in this program. And who will benefit from this program? At the moment, doctors who are from overseas, if you come from UK, Australia, and you have your MRCS, and not able to enter the training programs there, you can always join our program. Or if you have left the government service, either you resign or you are a contract doctor, your contract is no more renewed, you are most welcome to join our program. Also, for those who couldn't get the hadiah latihan for whatever reason, can join our program. And there are some doctors who, whenever they were not successful in the interview to join the KKM program, they tried a few times. They are most welcome to join our program. And just to share with you these statistics from KKM, you see in Malaysia in the year 2010 we have 539 general surgeons, and the ratio is 0.19 to 10,000 population. And in the UK in year 2010, with a 60 million population, you have 6,000 general surgeons, and the ratio of a general surgeon to population 1.1 to 10,000 population. And assuming from 2010, no general surgeon resigned, everybody's in good health, everybody continue to work. But by 2030, we'll have 1,539 general surgeons. We're still 0.42 per 10,000 population. But most probably this ratio will be much lower because people retire, people leave the service. So your future is very, very good if you join our program to be a general surgeon. So join us. We will make you a great surgeon. Yeah.
Yeah. We have to stop here because we have 2 more presentations.
Okay. So thank you. Yeah, my answer is that join us. We'll make you a great surgeon. Thank you.
Okay, Mr. Razak, we have a comment here from one of your former students, Yugendran Jegatisan. I'll read you his comment. I was a student of Mr. Razak. Amazing, his great wisdom and amazing qualities as a teacher. So a compliment for you. And I'm sure similarly, you will have many postgraduate students who have the same compliments of your, being a great surgeon, a great teacher. Thank you, Mr. Razak.
Oh, thank you.
I would
Thank
like
you.
now to move on. In the program should be Dr. Zarin, Associate Professor Clinical Zarin. Silakan. This is a slightly different program. This is not a master's program, but a training program in pediatrics. Silakan, Dr. Zarin.
Assalamualaikum and good afternoon, and thank you very much, Prof. and Tan Sri Sadia. Welcome. My name is Dr. Zarin. I'm a pediatrician, and we will be offering the postgraduate training in pediatrics. So the opportunity for a medical officer to stay in government service after their contract nowadays is very slim, and with no permanent post assured to them. And since the admission to the master's program is very limited, by the time they are eligible, they might already be unemployed. So the alternative of being a contract doctor in any universities are also a very restricted one. So despite all this, there are doctors out there who are still inspired to become pediatricians and who not if us to facilitate a way for them to achieve this. So the contention of by the KPJ University is to facilitate future doctors who wish to become and pursue pediatrics as their specialty. And I would like to be clear that we are not running our own program, and these doctors are aiming to obtain the MRCP-CH on their own accord. So by employing them with a KPJ hospital and assigning them to the consultants in KPJ pediatricians in such specialties, it will assure that they have daily exposure to pediatrics and prepare them better for the exam. So and also by enrolling them as a graduate student to our faculty, will assure that they are being supervised and are guided along their path to achieve this ambition. So they will also have a structure and a plan to take the exams, and because you cannot expect this from an individual who have no contact with MOH or no contact with universities, in which when they apply for a post for the parallel program in the government is rejected every time. So so by facilitating these individuals to have a clinical attachment to various pediatric hospitals, they will have a wider scope and exposure. So next please. So next slide please. Next. Next please. So we just go to these are our colleagues who are involved, and most of them are senior pediatricians in the country. Next please. So the criteria for admission, next please. The criteria for admission is as a medical officer with at least 2 years experience in services and have a recognized medical degree. And if they are eligible, they will be admitted to the program. The program is a 4.5 years program, which is an apprenticeship program, and we will facilitate and advise the student to attempt the MRCP and MRCP-CH, and by the end of the program, they would have fulfilled the requirement for MRCP and also the National Specialist Registrar. Okay, that's all. Thank you, Dato'.
Thank you for Zarin. Short, but I think it's enough to explain to the candidate the different way of training that we provide the clinical training, but candidates have to sit the CP child health. Yeah, this is very similar to the very sim. Thank you, Prazarin. Can you hear me?
Yes, Prof.
Okay. So we move on to another program, also different from the master's program, but conducted in KPJ for the clinical experience. I would like to invite Dr. Nur Hisham. He shared the same name as our DG, but this is our Dr. Nur Hisham.
Okay. So, thank you, Prof. Assalamualaikum warahmatullahi wabarakatuh and very good afternoon. I am going to highlight on the postgraduate training in internal medicine. It's similar, the program, the structure is similar to the PITS program. So the aim, the objective of this program is not to ensure an alternative pathway for you to obtain your so-called specialist training and to get it as internal medicine, which is required by the NSR. So two future potential candidates here. One is from the government, which have no opportunity to join masters, and who also don't have opportunity to join the parallel program. Second is also for the determinant medical officer who has resigned private clinic and in hospital who would like to pursue further. Next, please. Okay, the program is similar to the pediatric. There is a full-time postgraduate training, 4.5 years. Subsequently, for you to register as in the NSR. In the NSR, as you know that you have to fulfill two requirements. There is one so-called recognized program. MRCP is still recognized by NSR. Second, to complete the requirement training with logbooks and so on. Next. Okay, the program, as you mentioned here, you'll be fully attached to a respective hospital. You are also required to provide service because you are given so-called allowances, 60 hours per month in the emergency department, which I felt you can acquire much experience for internal medicine training. All right, next. Okay, these are the so-called specialists who had volunteered to be in the program. I assure you, about 25% of those are my teachers. So imagine I'm not young to see how much experience you have. Okay, next. So the selection criteria, we are not so strict. What we need basically 2 years experience in clinical service, preferably 1 year of internal medicine posting. We have MMC and also annual practicing certificate. And then we have we preference those with part 1, part 2. And the fourth one, you are successful in the interview section. Next. So this program is a 4.5 years program. First year on the first year, you'll be attached to general medicine. Second and third year, you'll be rotated every 3 months with all the subspecialty. At least I think minimum 8 subspecialty. And the final year, 1.5 years, you will be as so-called a senior registrar, where you are more independent in terms of managing patient. Next. So in summary, it's a full 4.5 years training in internal medicine. Candidate appointed as a registrar, apprentice in KBJ hospital doing rotatory. Candidate to sit for MRCP part 1, part 2, and part 3. I felt that part 1, part 2 is not that challenging, but I think it will guide you more on the part 3, that is the PACER clinical, and evidence of continuous supervised quality training to fulfill your NSR requirement. Duration may be shortened if candidates have prior experience posting internal medicine. Right, thank you very much.
Okay, thank you, Dr. Nur Hisham. Very similar pediatrics to pediatric program, and this is similar also to the so-called parallel program in the Ministry of Health. Do we have Dato' Wan Nick with us? Yes. Thank you. Yes. Thank you for joining us. Busy anesthetist, Dato' Wan Nick, wealth of experience in anesthesiology, in KPJ Damansara. He will explain to you briefly about this new latest program, not in the market yet, but insyaAllah, if not end of this year, maybe next year. Silakan, Datuk Nick.
Assalamualaikum, salam sejahtera. Thank you, Datuk Rahman. This is, as Datuk Rahman said, the program that has yet to take off, and the program which has a very long gestational period, just waiting for the baby to be delivered. You know, we have been working for it for quite a number of years, and we have been what they call it interviewed, and then what they call the panel accreditation, and they have gone through our program, and hopefully we will be able to start our program at the end of this year or early next year, or June next year, sorry. The requirement for the programs are similar to the other programs like masters and ENT and orthopedic, you know, 2 years of what they call it experience. They have to pass MEDEX exam, and then what they call it will be attached to these hospitals, what they call it that listed just now. We limit our number of hospitals for the moment, and the training which are basically done in our KPJ hospitals, in the Damansara Hospital, Tawakal, Selangor Specialist Hospital, KPJ Puteri, Johor Specialist, and Seremban Hospital. But there is no what they call it fixed places where the students will be posted to. They are very, very open, and then very flexible. And part of the training will be done in UKM hospitals, and as well as at the KKM hospitals, where you know the number of cases are more, like IJN, probably the respiratory negara, and what they call it here, the other hospital, the neuro center. Okay. Next, these are some of the what they call the facilities that are available in our hospitals, and this is the group of consultants, the core trainers that we have recruited. These are very enthusiastic consultants who have a vast experience. Many of them were former academic staff of public universities, and there are many others which will join in from time to time to teach. As the other, same as the other program, teaching will be 1:1, and probably some 2:1, 2 more teachers than the students. Right? Next slide, please. Next slide, please. The program, as I said just now, the candidates will be appointed as registrars in the Department of Anesthesiology and Intensive Care, and there are 2 exams, as I said earlier on. Part 1 and Part 2. Part 1 is first year, and then Part 2 is final year. In between, there will be continuous assessment every 6 months by the lecturers, and then whatever weaknesses that the students have will be rectified then. And then after the candidates have what they completed first year exam, they have to work on a project, they do some research, which will be what they call, they have to hand in before the final exam. Again, next please. This is the assessment, as I said, and then the degree that will be awarded, the Masters of Anesthesiology Intensive Care at the KPJ Healthcare GMC College. You know, the present masters in the public hospitals, normally there are about 500 or more students, candidates sit for the MEDEX exam, and there are about 100 or so only chosen to do the master's program. So you know how difficult it is, and this is one of the ways for those who don't qualify or who don't manage to get the place. Public hospitals have a chance to become a specialist in anesthesiology. That's it. Thank you.
Thank you, Dr. Wanik. Is in the pipeline. Hopefully, we get the provisional accreditation from MPA, and we can start the program if not end of the year, early middle of next year. Right, we have covered all the program. I hope it has been very informative for all of you. I would like to thank, I want to mention here, Gail Jing Hen Ku. He said he is joining us from the COVID ward pantry. But don't only spend 1.5 hour. Make sure your patient are okay in the ward, Gail. Okay, I have lots of comment and question. I will go through. We have actually exceeded exactly for 1.5 hours. But if you all agrees to stay on, we will answer all the question. Our consultant are ready to stay on. Boleh ya, Datuk Farid? Okay, first I'm interested. I'm interested Datuk Azlin to answer. Ada banyak question radiologi ni. From Aisyah Humaira, does radiology Medex boleh ke dia from Farhana, boleh ke dia pass Medex radiology? She's very interested tapi dia kerja dekat klinik kesihatan. I suppose the only radiology available there is the plain X-ray. So can she pass the Medex, Datuk Azrin? Susah tak Medex?
Medex exam is actually not very difficult. It is designed in such a way that we want to screen out the potential candidates now. I think the standard of the Medex exam is about the level of the final year medical student lah. The expected knowledge of radiology would be around that level lah, you know.
Yeah. Thank you, Dr. Azlin. And I suppose Dr. Tajun has some plan to have a course to prepare students for Medex. So KPJUC initiative, the radiology team, to make sure that they are successful in the Medex. The KPJUC team, I think in combination with I don't know, UPM or UM, going to prepare you for the Medex. How we go all out radiology. And also the next question is for radiology from Aisha Humaira. Does this training include interventional radiology?
Yeah, during the fall program, we actually assign the student to do simple interventional procedures now, you know. Those are basic interventional level 1 procedures that we expect all radiology candidates to be able to perform. For specialized interventional radiology program, that is a subspecialty altogether that will be done after you have graduated, and then and then there will be another 2-year program, you know, under different subspecialty, including doing interventional radiology. So basic interventional radiology will be covered during the 4-year course.
Okay, next question for Prof. Har. Prof. Har, can I join the ENT if no experience in ENT? Saya juga ENT surgeon tapi director kena jawab.
That one is depend on
preferable lah kan.
Yeah, it's preferable you have experience in ENT or any surgical base.
Yeah.
Any surgical base, at least other surgical base.
To make sure that you have passion for surgery, but not necessarily you must have ENT experience. All right, there's other question, general question which I will try to answer. Medex orthopedic, Dato' Wahab, dia dah check, dia tengok dekat website Medex, orthopedic Medex tak start lagi. Tapi dalam syarat dah masukkan Medex.
Boleh ada, tu yang heran tu. Dia biasa content orthopedics.
Yeah. That's why I think I put there question mark 2022. Yeah. So
tapi basically orthopedics will always look for basic sciences like anatomy, physiology, pathology. I think if you're strong in those trees, definitely you can get in or definitely can pass Medex. I think just make sure you know your anatomy, physiology, pathology, basics. Okay, most important.
Yeah. And I think it will be soon. The orthopedic punya Medex come up because I'm in the national deans punya council. They decided that all program will have Medex. That's why we put that question mark. But want to watch out. Those want to join any master's program, watch out for the Medex exam for each specialty. there is another compliment for Mr. Razak lah. One of your student is here, former student from teaching them. So compliment to you, Razak. Banyak student you ni tengok nak join surgery ni. You have inspired them. Farhana Nur Iman, my daughter. Okay. Okay, the others are all questions that I will try to answer lah. Yeah. Okay. First, a lot of question on the fee. What is the fee in the programs? Well, the fee for ENT is 200,000 for the whole 4 years course. Yeah. Because this was the first program is 200,000 for the 4 years course and is payable to KPJ per semester. So you can divide 200,000 divided by 8 semester. Yeah? So you don't have to pay the whole lump sum of 200,000. You pay only 200,000 divided by 4 per semester. As I mentioned just now, there is opportunity for bank loan or pharma loan, father and mother. You take your loan for your father and mother, you can pay back. When you become specialist, you can pay back in 1 month lah. Tu Datuk Farid lah. And of course, we encourage you to apply for Bumi Putra, Mara. And the rest also Peneraju, you can try. And other forms of loan. Tanya, tak ada scholarship ke? F.FH tanya. Sorry, no scholarship. KPJ provide you with the monthly salary throughout the course, and tak boleh lah semua nak minta KPJ bayar ya, Datuk Farid kan. The fee kena bayar, the fee bayar kepada KPJ UC. The salary or rather the cost of living allowance is paid by the hospital. And I've mentioned just now how much is that. For other courses, for the orthopedic, anesthesiology, and other surgery, the fee is 250,000. So 50,000 more is credit at a later program. 250,000 for the whole 4 years. You see, email to you sounds wow, 250,000 for, but you want to be a specialist, this opportunity and is much cheaper compared to your undergraduate in private. Of course, you cannot compare dengan public university lah ya. In private medical school pun ada yang sampai 500,000 kan. So that's the cost fees. I hope I have answered quite a number of you who asked about the fee. Can this program, can KPJ degree is recognized internationally? In bracket Australia, siapa tanya saya, cuba nak catat nama ni. Tak adalah. Not just KPJ degree, all our master's degree, in fact any degree now anywhere, we don't get reciprocal recognition. Even masters of UKM or UM, it is our Malaysian degree and recognized by the Malaysian Qualification Agency, MQA. And but that does not stop you from getting further training in England, in UK, in Australia, because we have so many masters graduates, including myself, who can easily join further training overseas with the degree that we have, the master degree in Malaysia, because we are recognized by MQA and MMC. Yeah, so a matter of getting the paperwork and you can do your training, further training subsequently overseas, no problem. Can contract officer apply the KPJ program? Tadi I think Mr. Razak dah answer tu. Yeah, this program is meant for for you, those who are a contract, not sure whether you can get full employment by kementerian, even those yang dah resign, and then you still have the burning passion to do radiology or orthopedic, this is where we give you the opportunity. Of course, you have to show your capability juga lah, by sitting the medex and later on study hard to go through the course. How many per intake? Well, at the moment, we are limited by the both the MQA, being quite new in the block. We are usually given macam ENT, we given 5 places only per year, and this goes to any university yang baru start between 2 and 5. But the other program only 3 per year. And for KPJ hospital at the moment they are supporting 2 a year. So not big number definitely for a start, but we hope that this will grow. At the moment 2 per year. So as mentioned by tadi, saya ingat siapa tadi Dr. Wahab mention quite tough to get into the KPJ program, but it's an opportunity. I hope you all will take this opportunity. Any age of eligibility? Oh, Dr. Wahab pun mention tanya semalam ya. Question from one of the candidates. Is to well, in our syarat-syarat kemasukan, if you look at the website, some programs ada age of eligibility limit, but we roughly, I mean, and in general, not more than 36 years old lah, because you have to go through 4 years, probably 4.5 years or 5 years. We want you to be a successful physician or surgeon before you reach the age of 40 plus lah kan. How will these candidates be selected? Well, I think most of the program has mentioned you have to fulfill certain criteria. For details, you can refer to our website. For each program, the entrance criteria. In general, they have number one is medex lah, medex, and then also important is the interview. We want to have we have this interview together with the hospital, Dr. Farid's team and KPJC team. It's integrated interview because we want to make sure that the hospital are comfortable and agreeable to employ you as the medical officer to receive the cost of living allowance. Will we get salary from KPJ? I think I've mentioned just now, yes, 5,000 when you're a student. Ada tanya, 5,000 aja ke? 5,000 aja ke? Well, we at the moment, yes. The answer is yes. I know some of you...
They can do locum. Buat locum.
Correct. Maybe some of you dah U52 memanglah, it's not as much. But for young doctors, we thought that would be comfortable enough. And as Dr. Farid mentioned tadi, there are a lot of opportunity for you to do locum in KPJ hospital, for you to top up your monthly ni. But just a word of caution, do not do too many locum sampaikan you tak dapat follow the cost properly. Yeah, locum is one opportunity to increase your income. Can we have ONG? Siapa nak jawab ni? Datuk Wahab.
You lah kena jawab. Is it in the pipeline? Is it in the pipeline?
Farhana Osman, Sheng Fat, ada 2-3 lagi tanya ONG. Very popular. I must honestly say that it's not in the pipeline because ONG punya training requires interaction with patient, and patient actually mothers, pregnant mothers, and delivery and all that in private will be a bit, I think, tough to offer that. But we have enough consultant who has been, sort of saying that it's possible, but need a lot of help from public hospital for the training, because the delivery in private ni, all the mothers want only the consultant to deliver lah, because dia bukan under GA kan. Dia under local, dia boleh tengok siapa deliver the baby. So but in the pipeline will be ophthalmology, probably 2023, and family medicine. KPJ have started what they call the ambulatory care center, where we have family physician to be employed by hospital, Dr. Farid. And once we have family medicine physician in the ambulatory care, then we can start the family medicine specialist training, probably through the either the masters or the FRCGP program. Right. Radiology answered. Medex Auto also answered tadi. Not yet in Medex, but soon. Costing I've answered. How many MOs already in KPJ? Well, let me explain. In KPJ memang ada MOs yang kerja dekat A&E tau. MOs that work in A&E. I think every hospital have what? 8, 10, that's about it. MOs.
Depending on the size, 8, 10, 12.
Yeah. But these are MOs who are serving the emergency department and also the wellness clinic, and they are not in the master's program, although we can offer them, and if they're interested they can join the program. But so there are hundreds of MOs already in KPJ, but in the master's program we have already, I think, close to 20 plus now in the program. And as I mentioned just now, quite a number have already graduated from the program. Abdullah Omar, I took Medex recently and passed. Boleh guna that for KPUC program? Oh, definitely. Kan, Mr. Razak? You want to comment on that?
Yes, we can do that for you. Since you have taken the Medex, we can use that marks for your next application.
Yeah. Cuma tadi Dr. Razak mention your pass tu must be good pass lah.
Must be good pass. It must be within the range that can be called for interview.
Yeah. So and I was made to understand that Medex you can take a second time to improve the marks, yeah.
Yes, you can take second time.
Yeah. Let's say they call it a band 1, 2, 3, 4, 5, something like that, lah. So you don't.
They're banned, but when they apply to this for surgery, we will contact the Medex board to give us the raw marks. The raw marks.
Yeah. Okay. Perhaps pediatric surgery. Pediatric surgery susah sikit kat KBA because we don't have many pediatric surgeons, as many as orthopedic surgeon, general surgeon, radiologist. We have anesthetists, ENT. We have berpuluh-puluh, tapi pediatric surgeon only, I think, a handful in KPJ. So,
not in our era. Maybe in the future.
Yeah, not in our era, because we want to ensure that the training we offer, we have the capable consultant running the program, training you, and number 2 is enough cases, enough case mix for you. So pediatric surgery is not in the pipeline because we don't have that number of pediatric surgeon, and also therefore not enough cases. I think I've run through most of your question, and let's Savira Sharma. I'm a contract medical officer who is very interested in pursuing surgical. Is there a chance of applying? Yes. You look at our site, fulfill the entrance criteria, and you will be able to be considered. Anand Kumar. Anand, worried about MQA for orthopedic. There was a question also. How to ensure that your program get MQA accreditation and MMC recognition? I tell you this. Of course, you can ask me, well, when we start the program, for example, anesthesiology, how are you sure that you can get recognition by MNC? Well, that is the process, you know. And at each level, we have to get the kelulusan lah. First is the level of provisional accreditation, and at the end of the training, you got full accreditation. We have to apply for accreditation. Yeah, it's not that we start the program, we got full accreditation. No, that's not the way. And along the way, there will be other assessment by MQA and finally by MNC. What I can assure you is we will do our best in offering this program to fulfill all the requirement of the assessment body, MQA and MNC. And along the way, there are sometimes areas that we need to improve. And that's the job of MQA. They will come back to us, say, look, you have not fulfilled 2, 3, and 6 criteria. We give you time. You have to show that improvement on this. And we are determined to do that. So at the end of the day, we hope that all the program will be getting full accreditation. But it's not always macam 100% terus dapat ya. Because we are private, we have to show evidence, we have to show dedication. But to the Muslim estate, inshallah, we will try our best. So similarly, orthopedic, we will ensure that we fulfill all the criteria and we inshallah will get the full accreditation by the end of the year. All right. So it's like so may I know if I'm eligible to enroll this year? Yeah, as I said, inshallah for orthopedic. Yeah. I know we are already. This now is almost 5 o'clock now. Is there any last words? I think I've answered most of your question. Any last words from the team?
Nothing much, bro.
Okay.
Thank you
All
to
right.
each and every one of you. Thank you, bro. And thank you for the participant. Hopefully, KPJ will be part of your colorful and successful journey in the future.
Okay. Yeah. Oh, one more question here. May I know if sekali if you pass MCAI? MCAI ni Datuk ni apa ni? MCAI Part 1 be completed to join the MS Masters program.
The Irish College.
Okay.
College
Well, of
Irish
course you
Ireland.
Yeah, of course you can join the program. You have passed the Part 1. Dato' Wan Nik lebih suka lah. You may have already prepared yourself, but in the master's program, you still have to undergo the 4 years of training. Am I right, Dato' Wan Nik?
Yes, that's right.
Yeah, we prefer to have people who have Part 1, the MRCP Part 1, Part 2. We will give priority. But in terms of training, because we have to fulfill the NSR and also the conjoint board, you have to undergo the 4 years training. Okay. We accept private practitioners as our internal medicine in the parallel program. Internal medicine, and we have to sit for MEDEX? No, internal medicine is a training program. No MEDEX. MEDEX only for master's program. And therefore, if a private practitioner, you have passion and still keen, you have to go through our assessment by the interview. If you think you're eligible, yeah, even private practitioner can join the MRCP program. Tak banyak lagi tambah ni. Okay lah, I think better stop here. Anyway, you all can join. I can look at our website. All the programs are there, including not excluding anesthesiology. We have yet to upload, but we cannot upload the program until we get the provisional accreditation from MQA. So once again, on behalf of KPJ Healthcare University College and on behalf of Datuk Farid from the hospital, it has been a pleasure engaging with all of you, MOs, housemen, medical students who are our potential client. We are here to offer you a pathway for you to become a specialist, and we open to other opportunity, besides the government or the university and KKM. So take the opportunity, consider KPJ and KPUC if you want to become a specialist. Right. Thank you very much, and wish all of you, number one, those in the frontliners, wish all of you the best. Stay safe. If you believe in ivermectin, do consider it. Controversial. But otherwise, follow the standard SOP. You are the frontliners. We wish you all the best. And to the rest, good luck and hope to see you in KPJUC when the opportunity comes. Assalamualaikum warahmatullahi wabarakatuh. Thank you to all the speakers. And not to forget, Encik Imran has been behind the scene, making the line and the communication good. I know there may be some hitch. Ada komen-komen ni tak clear lah apa, but I think generally it has been is good communication between the KPJ UC team and all of you. So, Assalamualaikum warahmatullahi taala wabarakatuh.
Waalaikumsalam.
Thank you all.
Kita